Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel College of Pharmacy. Today we are going to discuss about another disease from pharmacotherapeutics, that is hepatitis. So in this video we are going to briefly discuss about what is hepatitis, its etiology, pathogenesis, its types, clinical manifestation, along with what are the pharmacological and non-pharmacological management used in the prevention of hepatitis. Okay, students, let's get into the video. First, let's see what is hepatitis. So, hepatitis is a term which mainly denotes the liver. So, the viral hepatitis is a inflammation that causes and damages by the hepatitis virus A, B, C, and D along with E. So, the viral hepatitis is an inflammation that causes the liver inflammations, which is damages by the viruses A, B, C, D and E. So its epidemiology usually globally this hepatitis is around 2 to 3 billion people of the world are infected by one or more of the hepatitis virus, which results around 1.4 million deaths. In usually when we are seeing in India, it's around the chronic hepatitis B virus infection accounts for around 40 to 50 percentage of hepatocellular carcinoma. And next, the chronic HBV infection accounts for 20 to 30 percentage of the liver cirrhosis. And next, the chronic HCV infections accounts for 12 to 32 percentage of the hepatocellular carcinoma. The chronic HCV infection, which is accounts for 12 to 20 percentage of the cirrhosis. So these are the epidemiology conditions of hepatitis across globally as well as in India. Next will be the types of hepatitis. Usually there are 5 types, that is hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. So hepatitis A means it is caused by the hepatitis A virus and it's self-limiting and it may leads to the acute infections mainly transmitted by the contaminated food and water. So we know that the hepatitis A is a type of virus. So this hepatitis A type is caused by the hepatitis A virus that we will denote by HAV virus. So it's self-limiting and it mainly leads to the acute infections and mainly transmitted by the contaminated food and water. Next will be the hepatitis B. Hepatitis B is caused by the hepatitis B virus, but sometimes it's somewhat severe and it leads to chronic infections and mainly transmitted by the injectables. Next will be the hepatitis C. So hepatitis C, it is caused by the hepatitis C virus, which is severe and leads to chronic infections mainly transmitted by the injectables. Usually the hepatitis B and C are similar in nature. So they are mostly these two viruses can lead to chronic infections and it's mainly transmitted by the injectables. Next will be the hepatitis D. The hepatitis D is caused by the hepatitis D virus and it is commonly occurs in patients with hepatitis B. Once the patient is affected by the hepatitis B virus, it's the hepatitis B virus get easily affected the persons who are already affected by the hepatitis B virus, which causes the chronic infections and mainly transmitted by the injectables. Next will be the hepatitis E virus. It is caused by mainly the hepatitis E is caused by the hepatitis E virus. So it's self-limiting and it causes some of the acute infections and mainly transmitted by the contaminated food and water. So these are the 5 main types of hepatitis. Hepatitis A, hepatitis B, hepatitis C, hepatitis B and hepatitis E. Next will be the risk factors. In this tabular column, we can easily identify what were the risk factors and who all are easily affected by this hepatitis. The first will be hepatitis A. In hepatitis A, the most common problem is poor sanitation, lack of safe water, living in a household with an infected person. Usually, this hepatitis A can be affected by the poor sanitations, lack of safe water. So when there is a lack of safe water, living in a household with an infected persons, and it's also may causes due to sex with an affected partner, and it's also the use of recreational drugs. Patients may undergo blood transfusion and dialysis. So if a patient is affected by hepatitis, if they are giving blood to another persons, or they have transfused the accidentally transfused the blood of an hepatitis affected person to another persons, they can easily affected by hepatitis A. Mostly the poor sanitation and lack of safe water is the most common factors of hepatitis A. Next will be hepatitis B. In hepatitis B, usually the infants, children, and the injectable drugs users are mainly affected by hepatitis B, and it is undergoing blood transfusion. If the patients who are undergone the blood transfusion and dialysis can also affected by easily affected by hepatitis B virus. Next will be hepatitis C. So it is nothing but the injectable drug users, intranasal drug users, patients undergoing blood transfusion and dialysis, people live in closed settings, or if the persons may sex with the hepatitis affected partner, and the children which born to the mother infected with the hepatitis C virus, and the people who have tattoos and piercing may also easily affected by the hepatitis C virus. Next will be the hepatitis D virus. So it may also caused due to injectables, drug users, chronic hepatitis B virus carriers, people who are not immune to hepatitis B virus vaccines, and it may also caused due to if a person gets sex with the hepatitis affected partner. Next is hepatitis E. So it may also caused due to poor sanitation, ingestion of undercooked meat. Next will be the injectable drug users, and the patients may undergo the blood transfusion and dialysis, and children born to mother which are infected with hepatitis. Next will be the etiology of hepatitis. So the hepatitis A may be caused by the hepatitis A virus. Hepatitis B is caused by the hepatitis B virus. Hepatitis C is caused by the hepatitis C virus. Hepatitis D is caused by the hepatitis D virus. And hepatitis E is caused by the hepatitis E virus. It may be denoted by HAV, HBV, HCV, HBV, and HEV. Okay, these are the etiology of hepatitis A, B, C, D, and E. Next will be the pathogenesis. Usually, the pathogenesis of hepatitis A and E are similar. So, in these conditions, um, hepatitis A virus and hepatitis E virus mostly transmitted by contaminated food and water with HIV and HEV. So, when this HIV and HEV virus enters into our body, it gets reaches to the liver. There will be the activation of inflammatory cells, which releases the inflammatory mediators. Next, after there is a release of inflammatory mediators, the inflammatory changes in body. So, the hepatocytes gets damaged, and there will be the abnormal liver functions. And it may lead to acute liver failure. So, first the HEV and HIV viruses get enters into the body, and it reaches to the liver, which there will be undergoes the activation of inflammatory cells and the release of inflammatory mediators. Once there is an inflammatory changes in body, hepatocytes gets damaged. Hepatocytes gets damaged and there will be the abnormal liver functions and accumulation of toxins leads to acute liver damage. Next, it will be the pathogenesis of hepatitis B, C, and D virus. So, when this B, C, and D virus get into the body, it also gets enters into the body. It reaches to the liver, activation of inflammatory cells, which releases the inflammatory mediators and the inflammatory changes in the body, so that the hepatocytes gets damaged. There will be the abnormal liver functions and there will be the accumulation of toxins and acute liver damage. So further, when there is an acute liver failure, it may lead to the prolonged time and the excessive accumulation of this extracellular matrix proteins includes collagen fibrosis, which may lead to the scarring of liver or cirrhosis. Abnormal regeneration of cells or hepatocellular carcinoma. In hepatitis A and E virus, it may up to the reach of acute liver disease, but in the hepatitis B, C, and D virus, it may lead to a hepatocellular carcinoma. So, the acute liver failure happens for the prolonged period of time, which may lead to the excessive accumulation of extracellular matrix proteins, so that which including the collagen fibrosis. Next, it may lead to the scarring of the liver cirrhosis. Scarring of the liver means nothing but the liver gets teared or this condition is known as cirrhosis. So it's the final conditions of acute liver damage. And the next it will be the abnormal regeneration of cells and hepatocellular carcinoma can occur in the liver. So the clinical presentations. So this is the clinical manifestations of both all the five types of hepatitis. Usually in hepatitis A, it's an acute failure. So it may include anorexia, then nausea. Usually there will be the sensation of vomiting. Fatigue. Fatigue means they may be feeling somewhat tired. Malaise, vomiting, fever, headache, right upper quadrant, abdominal pains. We know that the abdomens can be converted into four types, four sides: the right upper, right lower, left upper, and left lower. So in the right, mainly in hepatitis A conditions, the right upper quadrant abdominal pain may occurs. Next will be the dark urinations and alcoholic stools and pruritus. Next will be the hepatitis B. So it is a chronic failure. So in these conditions, there will be fatigue, anxiety, anorexia, malaise, ascites, jaundice, variceal bleeding, hyperexcitability, impaired mentations, and obturations, coma. So, it may lead to coma also. The hepatitis B virus may lead to coma also. Next will be the hepatitis C virus. So, it is also a chronic failure. Here, hepatitis A and E virus, E disease will be the acute failure, but hepatitis B, C, D will be the chronic failure. So in chronic conditions, it's mainly affects the certain manifestation. It shows certain manifestations like fatigue, anxiety, anorexia, malaise, ascites, jaundice, abdominal pain, dark urine. In advanced stage, it may lead to spider navy, splenomegaly, palmar, erythema, testicular atrophy, and caput medusae. So these are the in the early stages it will be like the symptoms as we have studied in the hepatitis B, hepatitis A. But in the advanced state it may also shows spider navy. Next what splenomegaly, palmar, erythema, testicular atrophy, caput, medusae, etc. Next will be hepatitis B. Hepatitis B virus shows chronic failure. It shows jaundice, abdominal pain, vomiting, loss of appetite, dark urine, fatigue, etc. Next will be the hepatitis E. It also shows some acute failure. So it shows the symptoms are similar to hepatitis A. It includes anorexia, nausea, mild fever, abdominal pain, itching, skin rashes, joint pain, jaundice, and hepatomegaly. Hepatomegaly is nothing but there will be then inflammations of liver. Hepato is a term which denotes the liver. So hepatomegaly means inflammation of liver. So these are the clinical manifestations of hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Complications of hepatitis. The complications of hepatitis which includes acute or subacute hepatic necrosis, chronic hepatitis, cirrhosis, hepatic failure, hepatocellular carcinoma, glomerulonephritis, cryoglobulinemia, hepatic encephalopathy, portal hypertension, porphyria, HIV infections. So these are the complications which is associated with the hepatitis. So mainly here the acute and subacute hepatic necrosis which includes the scarring of the liver. Next will be the chronic hepatitis which is the severe conditions of hepatitis. Next will be the cirrhosis. It may lead to the scarring of liver. Next is hepatic failure, that is the complete failure of the actions of liver. Next will be the hepatocellular carcinoma, that will be the formation of cancer cells in the liver, that is hepatocellular carcinoma. Next will be the glomerulonephritis. So that it may also affect the glomerulus as well as the nephrons. Next will be cryoglobulinemia. Next is the hepatic encephalopathy, portal hypertension, which also the main complications of hepatitis. Next is the HIV infection. So HIV infection is also the major complications of hepatitis. Um, Next is the diagnosis. What are the diagnoses can be taken to treat the or to understand the diagnosis of hepatitis? First will be the physical examination. Next will be the liver function test. Next is the anti-HIV testing. That is the test for hepatitis A virus. And next will be the HbSAg testing, anti-HSCV testing, HDV testing, HEV testing. And next will be the liver biopsy along with the ultrasound of the liver. So these are the diagnosis which is used to understand the complications of hepatitis as well as to understand the disease condition of this hepatitis. Next will be the non-pharmacological management. So in the non-pharmacological management, we have to give the hepatitis vaccination for both hepatitis A, B, and E. Next will be the immunoglobulin treatment, and we have to give counseling about risk factors and transmissions. We have to stop the alcohol consumptions, stopping of smoking. We have to engage our body so that we have to do some of the physical exercises. Along with if there is any further liver failure or later stage of cirrhosis, we have to do the liver transplantations. So these are the non-pharmacological treatments which mainly involves in the hepatitis treatment. Next will be the treatment algorithm. First we have to, for hepatitis A, mainly we have to give the vaccinations, immunoglobulins, symptomatic treatments. Mainly contains the symptomatic treatments. We have to treat the symptoms. Next will be the hepatitis B. In this we have to give interferons, pegylated interferons, Entecavir, tenofovir, adinavir, lamivudine, telbivudine. These are the antiviral drugs which is used to treat the hepatitis B virus. So, entecavir, tenofovir, adinavir, lamivudine, telbivudine. These are the antiviral drugs which is used to treat the hepatitis B virus. Next will be the hepatitis C. For that, it will be of two types. One is with cirrhosis and another one is without cirrhosis. For with cirrhosis, it may be of genotype 1A and 1B. For that conditions, we have to give declatasavir and sofosbuvir for 12 weeks. So these are all will be the antiviral drugs, retroviral drugs. So declatasavir and sofosbuvir for 12 weeks. Next, for that alternate, we can also be given simipravir and sofosbuvir for 12 weeks. If they have any resistance or sensitivity towards declatasavir, we have to give or alternate to we can give alternately the simipravir with sofosbuvir for 12 weeks. For with the cirrhosis conditions, we have to give declatasavir, sofosbuvir, and rifavirin for 24 weeks. If it's without cirrhosis, we can take the medication for only 12 weeks. And if it's with cirrhosis, we have to give the medications for about 24 weeks. Same for the sensitivity of declatasavir, we have to give simipravir with the sofosbuvir and ribavirin for 24 weeks. For the genotype 2 type, first will be the declatasavir with sofosbuvir for 12 weeks. But with cirrhosis, we have to add a ribavirin for 24 weeks. For genotype 3, we have to give declatasavir plus ribavirin with PEG, polyethylene glycol interferon for 20 weeks. For with cirrhosis also, it will be around declatasavir plus ribavirin plus polyethylene glycol interferon for 12 weeks. So these are the treatment algorithm for hepatitis C. So mainly we have to give the antiviral drugs which includes declatasavir, sofosbuvir, simipravir, ribavirin, polyethylene glycol interferons, which will be for without the cirrhosis, we have to give it for 12 weeks, and for with cirrhosis, we have to give it for 24 weeks. Next will be the hepatitis D. For hepatitis D, we have to give polyethylene glycol interferons for 48 weeks. And mainly it will be around liver transplantation in case of fulminant hepatitis and the end stage of liver disease. If the liver disease is under the end stage, we have to give liver transplantations or during the later stage of liver disease. Otherwise, we can give polyethylene glycol INF for 48 weeks in hepatitis B. Next will be the hepatitis E. We have to give vaccinations. Next is symptomatic treatment. That means we have to treat the symptoms first. Next, ribavirin in case of immunosuppressed people. If they have any immunosuppressions, they have to take the ribavirin. Next will be the drugs used in the treatment of viral hepatitis. For that, first we have to, for the drug category IG, we have in the category of immunoglobulins, which produces the passive immunity with a dose of 0.02 ml per kg with the route of intramuscular route. Here we have to take this immunoglobulin up to 0.02 ml per kg with the intramuscular route. So it may also have some of the adverse effects like headache, erythema, myalgia, malaise, injection site reactions. Next will be the pegylated interferons, so that it enhances the activity of phagocytic activity of macrophages and cytotoxic activity of lymphocytes for the target cells. So it acts as the category of immunomodulators. So we can give 180 milligrams for once weekly for 24 to 48 weeks. Up to 24 to 48 weeks, we have to give only once in a week. It may also have some of the adverse effects, which includes fatigue, headache, fever, myalgia, influenza-like illness. Next will be the entecavir. Entecavir will be the antiviral drugs, which includes nucleoside reverse transcriptase inhibitors, which inhibits the viral replication, so that we can give up 0.5 to 1 milligram drugs, which will be taken as OD once daily. It also has some adverse effects like fatigue, headache, dizziness, nausea, diarrhea, etc. Next will be the tenofovir, which is also a antiviral drugs, which is a nucleoside reverse transcriptase inhibitors. So it inhibits the viral replications. Usually, we have to take around 300 mg per OD. Once daily we have to take around 300 mg. It also has some side effects, that is asthenia, diarrhea, nausea, pain, anorexia. Next will be the lamivudine. Lamivudine is also a antiviral drugs, which inhibits the nucleoside reverse in transcriptase inhibitors, which inhibit the viral replications around 100 mg OD. Next will be the adverse reactions. It also includes diarrhea, cough, fever, joint pain, pancreatitis. Next will be telbivudine. Telbivudine, which includes nucleoside reverse transcriptase inhibitor, which inhibits the viral replication. Usually, all the antiviral drugs are nucleoside or nucleotide reverse transcriptase inhibitors, which is inhibits the viral replications. Usually we can give around 600 mg once daily. It also has some adverse effects, which means fatigue, headache, cough, diarrhea, and abdominal pain. Next will be decletosavir, which is a HCV, that is hepatitis C virus inhibitor. So, which also inhibit the viral replications. We have to take around 60 mg once daily. It also has some of the adverse effects like headache, nausea, fatigue, diarrhea, elevation of lipase levels. Next will be the sofosbuvir. It is also a hepatitis C virus inhibitor. It inhibits the viral replication, so we can take around 400 mg once daily, which also has the similar adverse effects of decletosavir. Next will be the simipravir. Simipravir is another antiviral drug, which um, inhibits the hepatitis C virus protease enzymes. So we can give it around 150 mg per once daily. Maybe it also have some of the adverse effects like photosensitivity, hyperbilirubinemia, pruritus, dyspnea, and malaria. Next will be the ribavirin. Ribavirin is also another retroviral drug. So it mainly inhibits the synthetic nucleoside analog of ribofurunose, which inhibits the viral protein synthesis. It inhibits the viral protein synthesis. So we can take in around 800 to 1000 mg. We can take it around twice daily. So it also has some adverse effects like fatigue, headache, myalgia, hemolysis, and rigors. Okay, students, I hope you all have learned about hepatitis. So in this video, we have completely learned about what is hepatitis, its type like hepatitis A, B, C, D, and E viruses, its pathogenesis, etiology, along with the pharmacological and non-pharmacological management. In the pharmacological management, we have briefly discussed about the retroviral drugs, which is used in the treatment of hepatitis B virus. I hope you all have completely learned about this hepatitis B virus. Okay, let's see in the next class with another disease. Thank you.